I love session 5 because in session 5 we start to explore how on earth we can create change, long-term change in our lifestyle. Up to this session, we've basically spoken about negative things. What we're doing today is we're putting a light at the end of the tunnel, but by the end of today, the light will be so big that everybody will see very clearly, precisely what they need to do, and then we will go through a process of deciding precisely how they're going to carry the changes out.
I would feel very comfortable and confident to make changes having correct information.
From what we've learnt in the last 5 weeks, I'm very excited about this lifestyle change and I can't wait to start. I wish I could do it now, tomorrow. Well, I will start some things tomorrow, and that's what we've learnt so far has blown me away because it is simple.
I feel more confident with the knowledge that I've got now to go forward and make the changes and actually be able to succeed.
Having our doctor on board will be great.
Having my doctor involved is because, well, when I'm on some medications as well, so I need to be confident that that anything that I'm doing is not actually going to make my situation worse with my blood pressure or weight and the arthritis that I've got developing.
I think it's really important to have information. I think the things that we've been taught have helped us to make decisions about lifestyle changes because we know that, well, for instance, that blood sugars are going to normalise fairly quickly. We know how we're working in conjunction with our body, how the immune system is going to have a really good hit. So all that sort of gives us confidence in making decisions about doing it. And I'm glad that the doctor's on board with it because that makes me confident too, because I'm glad that medications can be monitored that way as well as all the other signs about my health.
I feel that without the correct knowledge and also understanding, it's going to be very easy to fall off a bandwagon, and that's happened too many times with different diets and changes in the past. And you need to know really what you're doing, and you really need to know that it's going to work.
Being able to go through the journey, knowing what we do know now and being informed of how it all works makes it easier to be able to stick to it, knowing what to expect. In my situation, I need the doctor on board with some of the medications I'm on. I have very low calcium levels and I'll need him to monitor those as I go, as well as my blood pressure.
I need to make sure that my doctor's on board because he needs to be able to keep tabs on my medication and see how I'm going with my general health.
Making the changes with the knowledge that we have now got really empowers us to make those changes easier and to buy the correct food.
Making changes based on the correct knowledge, it sort of gives you the confidence that you're doing the right thing and you're going to make changes that are going to make you better and get you to where you want to be, rather than taking the long road around where you're just dabbling in all different diets and that, and always ending up with the same result where you just go back where you started or even worse. Having your doctor involved is really important because you can sort of look at your health as you're progressing along, and it's sort of checking that you're doing the right things, but it also gives you confidence that, and even sort of the confidence to move forward further into it because you're seeing the progress you're making, and he's able to tell you that yes, you are making that progress. You're not just having to check for yourself, and it sort of keeps you more accountable for what you're doing because you have somebody that's coming along with you on the journey. So there's more reason for you to succeed, not only for your own happiness, but to prove to people around you that you're getting to where you want to be.
It's important, I think, for the doctor to be involved because he monitors your progress, and then he will be, and not only that, is that he can see for himself the changes that happen.
I find it very reassuring with the knowledge that I've been given that this is actually something which has worked for many people, that people have had this experience, and I feel confident going forward that it's going to do something good for me.
I'm excited to see the changes that are going to occur in my body, and I'm really excited to start feeling better in myself. So can you tell? I'm excited. So I'm looking forward to the next few weeks.